Hey, I'm Eden.
And I'm Bini&Eden.
And we're the B family. So in today's episode, I'm going to be sharing my birth experience with you guys in Uganda. I gave birth to my third out here. I'm going to be breaking down kind of a comparison between giving birth in America and giving birth in Uganda. Also, I'm going to be sharing the cost with you guys in USD. And my experience with the doctors and the whole staff. So please stick around. I hope you guys enjoy this episode.
So, what made you confident enough to have a baby in Uganda after having our first two children back in Atlanta, Georgia?
So I think you were spending a lot more time in Uganda doing construction, and you were back and forth to us. I was in Atlanta with the two kids. He was in Uganda, and it just started to get a little lonely. I was like, I can't do this. This is hard with two kids, and just imagining having a third kid, and he has to be in Uganda, 2 to 4 weeks at a time was daunting. So I'm like, you know what? If you're going to spend more time in Uganda, we've already got a house. We can, kind of maneuver around until the house is done. Let me check out the hospitals. And I think, actually, let me take that back. The one thing that did give me the confidence is it was my third kid, A. And not only that, our second kid, which we'll make another video about it because it's a whole ordeal, she was born at home. And big ups to the home birthers, and I'm not one of them. I wanted my doctors. I wanted access to any emergency capabilities. So it was not planned. Like, she kind of just fell out. She fell out. So I think that gave me the confidence because I figured if I can give birth at home, unplanned like that, I can handle it. And to be honest, I came to the hospitals before I decided to give birth. I did go to about 3 hospitals. Vetted them, talked to them, and I think that's kind of where I decided I can do this. I can give birth in Uganda. And Roswell is where we chose to give birth.
How did you come to choose Roswell? Were there any other hospitals that you saw? When you got to it, how did you essentially come to the point where, you know what, Roswell was it, and you made that choice and you went with them as far as the place you're going to have the third child?
So Roswell, like I said, I went to 3 different hospitals, and I think Roswell stood out. Their customer service was off the chain. It was very clean and organized. The other hospitals were good, but I didn't get that initial warm greeting, the hey, how are you? How can I help you? Because I'm clearly pregnant, and I think the other 2 hospitals were very blasé. They kind of just took their time, didn't really greet me. And I think, being pregnant, you're a little emotional. It was my first time there. I didn't know how the country operates really. So I was like, they don't want me as a customer. So I'm like, you know what? But when I went into Roswell, it was just such a warm greeting. Like, as soon as we walked in, they came to the door, they greeted us, they asked us how they can help us. And I think that made me feel warm right away. It was just the customer service that they gave was top notch.
I can attest to that. They were very friendly folks. I mean, they were very caring. They were very professional, extremely professional, and they seemed like they had a ton of staff and support system around her at the time. I was a supporting cast, so I can't really speak to the experience, but I can attest to the fact that the hospital is extremely clean. We were walking to the rooftop.
Outside. We're in the streets.
They have an area there. They have a beautiful waiting room, a wonderful pharmacy. Which gets us to question number 3. How was their rooms? What did you think about their VIP room? Because we did have a birth in their VIP room, and then we'll get into the cost as well. But first and foremost, how were the rooms?
Man, the room was amazing. It was, it was like 3 parts to the room. There was a 2-bed area, and then there was the birthing table, and there was a living room. I was like, this is amazing. It was a suite. So it was very comfortable, very professional. The staff was literally with me from beginning to end. When I first got there, I was, obviously I was going to be a little hesitant because I didn't know what to expect. So I was very demanding. I had a birth plan, and I was like, I want to go with this. I want to make sure they know what I want. And to be honest, I didn't expect them to really come through on all of my expectations, but they did. I came American birth. I came with a birth plan. So I told them, I have these expectations. Before anything, a couple weeks before birth, they sat down with me. Sat me down with all the midwives. I think it was about 7 attending midwives then. It wasn't guaranteed that they'll all be with me, but the doctor did sit me down with all of them just in case I come at a time when one of their shifts starts. And it was an amazing conversation. They were very open to what I wanted. They were taken a little bit aback, which at first I thought was going to be a con. I was a little nervous about it because they were like, "Oh, we have pain medication." And I was like, "No, I don't want pain medication. I want to be able to give a natural birth." And a few of the midwives kind of looked at me surprised. And deep down inside, I didn't feel funny about it, but I was a little hesitant because I'm like, "Oh man, I hope they don't try to push pain medication on me," because that's what happened with our first kid. Comparing it to the U.S. Hospital, the first hospital I gave birth to with my son, they were nice. My OB was great and all that, but the hospital staff, the nurses really were trying to push epidurals on me. They really were. The pain medication, they kept telling me, "Oh, you're only this much dilated. It's going to get worse. I don't know if you want to go through the pain." And it was a lot of subliminal messages of, "You can't do this." And I think that terrified me the first time around. Ended up with an epidural. I had a debilitating wrist ailment for about 3 months. I could barely pick up my son. He was a fat baby. He was born like 10 pounds, but still, it was like I had I can't remember if I'm saying it right. It was Quervian tendonitis.
Okay.
If any moms are out there, if I'm saying it right, and any doctors, let me know. But it was Quervian tendonitis, where you literally cannot move your thumb. So this nerve right here, every time I moved it even a slight fraction of an inch, I would be like in pain, doubled over. So that had to do with the epidural. They poked into my spine a little too deep. And so I got a spinal tap, which meant that I had spinal fluid dripping down. So within 24 hours, every time I sat up or stood up, I would get a debilitating migraine. And that was because they took the epidural too far into my back. So I was against any pain medication. I was like, please, I don't want to go through this again. And in Uganda, they did offer epidurals. They said they do offer, and I told them, absolutely not. Don't let me, even if I scream for it, don't give it to me. And they were very, very hands-on with that. They were like, "No, you told us." Because at one point I did tell them, "You know what? Just give me the shot. I got a little bit left." They were like, "No, madam, you told us not to." So big ups to the doctors. They were really good, to the midwives.
Speaking of the doctors, how was your gynecologist? The specialist that you work with? Remember there was a physician and like 3 nurses. I felt like you had a whole team all to yourself. I know they said VIP, but it was really VIP. So can you speak to the professionals, to the skills of the men and women that helped you give birth?
Definitely. It was, so my OB, his name was Dr. Jaffer. Shout out to Dr. Jaffer. He's a great OB. Hilarious. He would make me laugh as I'm like screaming. He'd say something funny and make me laugh, and it actually kind of helped. It alleviated a lot of the pain. I had a physical therapist. She would come in every 3 to 4 hours, check on me, make sure I was moving, to motivate me. The kitchen staff would come in every few hours to ask me if I want to nibble on something, if I want more tea, more juice. I mean, the hospital, I felt like the hospital was shut down for me, and it wasn't. I mean, it was a fully functioning hospital, but that's the kind of care I received. I felt like everyone was catering to me, and it felt so amazing, because I know in America I was a number. I shout out to the hospitals in America. It is what it is, but you definitely don't feel that kind of care. Well, I didn't feel that kind of care at the hospital I went to. And I went to a very good hospital, Wellstar in Roswell. So it was a great hospital, but still, a hospital there doesn't stop feeling like a hospital. The hospital I went to in Uganda, Roswell Women and Children's, felt more like a home care birthing center than it did like antibiotics and medicine hospital. And they weren't trying to push medicine. They were very hands-on.
So I remember we were there for 3 days. The level of care was awesome.
The food.
The food, okay, the food. Speak on the food.
The food was amazing. The food was really good. Like it smelled. It was local food. It was really healthy, but it wasn't overly greasy. It didn't taste like hospital food. Like my last experience, I'm like mashed potatoes and apple juice. Cool, I'll pass. And I was getting full fast, so you kept eating my food. But
Sure did.
the food that I did eat, it was really good. I did enjoy it.
Okay. So food was great. We were there for 3 days. What everybody would like to hear, and USD, especially a lot of Americans out there that deal with the cost of healthcare that's been out of control in the United States for so long. How much did all this cost?
When we total it all up, 3 days, 2 nights? Yeah, 2 nights, 3 days, everything included, all of my antenatal care, like the prenatal appointments and visits, food, everything, delivery. When it totaled up, it came up to less than $800.
You heard it. Less than $800 for the whole entire experience of giving birth to a child in Kampala, Uganda, at Roswell Hospital. And I can attest to, I worked in healthcare in the past. I worked at Atlanta Medical Center. I've been 10 years in healthcare in the past, and I could tell you folks, it was a great experience from a supporting cast, from the husband's point of view, that is. I felt like she had all the help that she could need, she could want. But more importantly, a lot of folks out there, dealing with the American healthcare system. It's not just the amount level of care. Even when you are paying an arm and a leg, and you don't mind paying an arm and a leg, you don't get the care that you deserve and that you hope for. But $800, less than $800 to give birth. We didn't expect that. We honestly felt like they made a mistake in giving us the receipt. We asked them, "Is this it? Is this it?" And they kept saying, "Yes, this is it. What do you want? What do you want more?" And we were just feeling so fortunate and blessed. Now, to put it in perspective, $800 for the average Ugandan is a lot of money.
Yeah.
It is a lot of money. Is it by no means to say that this is affordable for an everyday Ugandan. So really keep that in perspective when you're coming over to Uganda, and always think the folks out there work really hard, and that is maybe a couple years savings for them. So, but we feel fortunate enough that when you are coming from the West, when you are coming from the United States, $800 is they've charged you for Tylenol at the hospital for that, which comes to it. We want to speak. We've talked about the positives, the cost. Now I want to ask you about any negatives, any cons about giving birth in Kampala from your experience.
Honestly, I can't think of any. 'Cause I'm really racking my brain because the only thing that con I can even attest to is when I said I wanted non-medicated and they looked at me kind of hesitant. That's the only time that I even felt a little bit of like, oh, am I making the wrong decision? Should I have just stuck with giving birth in America? But outside of that, from the prenatal care that I received to the during delivery and the aftercare that I received, I can't say anything negative about it. From the cost to the care, to the follow-ups, the checkups with the baby, it was amazing. I mean, they weren't really, even after birth, they weren't trying to push any more medication on me. They weren't trying to push unnecessary vaccines on the baby. I really can't say any cons. The only con I can say is maybe not for us specifically, but it's a private hospital, so it is more expensive for a local Ugandan, perhaps. So I think that would be the only con that I can think of from an outsider's perspective. I think as coming in with US dollars, it's a lot fortunate because it's a lot easier because with our second kid, like I said, I'm going to make another video, but just to give you a price comparison, I had this baby at home. You cut the umbilical cord, like our OB, my midwife talked me through it, and the ambulance came in. When we got to the hospital, after giving birth at home, refusing any medication just because I didn't need it, I wasn't in any pain, she was already out. We had to spend the night just because that was their procedure, but I was fine to leave the same day. Our hospital bill was $8,000. And I'll break that down in the next video that we do for that. But I'm like, $8,000 for an ambulance ride there. They charged me twice because they charged me as the patient. They charged the newborn as another passenger. I had to call the ambulance company, like, are you kidding me right now? You're not, did you drive double because there was a second person in the car? I mean, it's really it's a joke. So coming here and seeing the price, the $800, super happy with my experience. I can't say any. If we decide to have another kid, I'm 42, so don't bet on it. But if I were to have another kid, I would definitely have it in Uganda. It was just too easy, too convenient.
All right, folks, you heard this from us. $800 versus nearly $8,000 for having a baby at home and then just taking a hospital ride. So Uganda is a great place. Not only is it a great place, but you can have the standard of healthcare that you want to have a child. We did it. We had our third child there, and it cost us $800 versus our first child. I think we got some kind of $40,000 bill, if my memory serves me right.
Yeah.
Our second baby we had at home all the way. I cut the umbilical cord myself. It just, God's grace. And then we got that $9,000, almost $8,000 to $9,000 bill from the ambulance company, and I think they gave you Tylenol, if I'm not mistaken. But in Uganda, Roswell Hospital, VIP room, 3-night stay, multiple people taking care of my wife and kid, and it was just under $800. So if you ever want to decide can I have a baby in Uganda, what does that look like? Yes, the facilities are there. They're very cost effective when you're coming from the United States. And these numbers are all in USD, and we'll break them down even further for you in the future. We'll talk about child health care, adult health care. I've luckily have never had to visit the hospital in Uganda or gone to, my wife has. Our children have. My son Eli always deals with a stomach bug constantly. Malaria twice. And the healthcare facilities were up to par. So the healthcare facility is the standard. They are there. Now, you will be paying private fees. These are not public hospitals, as you would say, but they're very affordable when you're coming from the United States. Very affordable. Any closing thoughts?
No, I mean, I guess if you have any comments or questions, I'd be happy to answer them. I know quite a few women that have given birth in Uganda, from all over, from Europe, from America, from throughout Africa. So I think there's a lot of people choosing to give birth in Uganda, and it's very doable. It's very convenient, and it's an amazing experience. So if you have any questions, comments, please feel free to ask, and like and subscribe so you can follow up on more content. We'll be sharing a lot more. So yeah, thanks for staying with us.
Until next time, this is us, the B family, all the way from Kampala, Uganda. We'll see you soon.